It's good to hear that your disease is stable and it looks like you're doing very good to a point where you're not even on any active treatment, which is all good news. Um, I don't think, in terms of COVID-19 risk, you are at any additional risk than general population. And I'd like to reassure you that most patients, 75 to 80% of patients who get infected with this disease will self-resolve with just mild symptoms. So only if you have any worsening of symptoms, especially shortness of breath, that's when you need to seek medical care. But most patients with COVID-19 would self-resolve. You need to quarantine yourself so that you don't infect others. And just like we mentioned, make sure you eat and drink well, rest well, and your body would fight it off for most patients. Based on the current lack of data, I don't think we have clear-cut guidelines for NET patients. I would basically have similar guiding principles for any cancer patient, and for that matter, anybody with a lot of comorbidities and medical issues. What's the appropriate way to quarantine? If somebody knows that they have fever or have been tested positive for COVID-19, I think they should limit their contact with definitely public. They should be wearing, if at all they have to go out of home for example, for a healthcare checkup visit, they should be wearing a mask if they are sick, because that way they can prevent the droplet from infecting other people. Uh, they have to be careful at coughing and sneezing. Try not to use your hand. If at all, you have to use the tissue and try to discard that appropriately. Um, and As I mentioned before, rest, eat well, hydrate yourself well. And if these symptoms are getting worse, and by that I mean, the fever is not subsiding and patients are developing shortness of breath, those would be some of the worrisome red flags which I would recommend seeking medical advice. But most patients would overcome this, and your body would fight off, uh, you know, and can take anywhere between 1 to 2 weeks, up to 3 weeks, to get better. But stay at home, try not to infect others, get some rest, and use mask when outside. Those would be some of the key key things. Right now we do not have any approved, scientifically proven cures for this disease.
Right.
There are a lot of trials looking at agents for both prophylaxis, that means to prevent COVID-19 in close family members or healthcare providers who are at high risk, and also as a treatment in those who are already tested positive for COVID-19. But at present, the jury is still out. Different countries have different guidance documents regarding the use of, chloroquine or hydroxychloroquine, azithromycin. I would recommend the viewers to follow what's been recommended in their particular region of the country. In the US, as far as I know, there's no blanket approval for prophylactic use of these agents. They are under investigations, multiple trials currently ongoing, and I'm very hopeful in the next few months. Hopefully, we'll have some data. There are also trials ongoing regarding certain antiviral agents. In fact, multiple phase 3 and randomized trials going on, and I'm hopeful that one of these drugs would pan out to be helpful in treating COVID-19. But as of now, we don't have a short treatment or cure which has been scientifically proven in a rigorous study. Well, technically, not all neuroendocrine tumor patients would be classified as immunocompromised. There are certain patients who are on certain treatments, for example, chemotherapies. Some of our high-grade neuroendocrine cancer patients might be on IV chemo, and certain low-grade neuroendocrine tumor patients could be on capecitabine temozolomide.
Mm.
These are cytotoxic chemotherapies and can affect immune cells, the white blood cells. And these patients are certainly at increased risk for infections. There are certain other drugs that our net community members might be aware of, like Afinitor. Afinitor is an mTOR inhibitor. It's a pale form of targeted therapy we use to treat neuroendocrine tumor patients.
Hmm.
And before we used it in NET patients, the low dose of this particular medication was used as an immunosuppressant and still is in our transplant world. So technically, Afinitor can also cause immunosuppression, and lymphocytopenia is one of the white blood cells which helps us fight various infections, especially virus. So I would not give a blanket statement that
Okay.
all NET patients are immunocompromised. Certain NET patients can be immunocompromised based on what treatment they are on. And in general, I think having history of cancer or active cancer is considered one of the comorbid illnesses, just
Mm.
like having diabetes or high blood pressure. It's a chronic inflammatory state, and that does in a way can potentially affect somebody's immune system, but not necessarily an immunocompromised state. So we often use this term in certain infectious states where immune systems, which is basically our white blood cells, are
Hmm.
down. For example, HIV/AIDS.
Mm.
There's a infectious disorder which, in particular, targets our immune systems. There are certain malignancies which targets immune systems, like certain lymphomas and blood disorders, where white blood cells, they are downregulated. So in general, what is, to kind of build on this concept, um, our immunity is our ability to fight infection or any
Mm.
foreign agent in our body. And how our body does that is through various ways. There are various defenses that we have. Some defenses are basically physical defenses like skin, right? So,
Right.
so not we are not exposed to everything unless we have a cut. If a foreign pathogen is able to enter our body, then we have different sort of immune systems, like innate immune system, to kind of combat that. And then we have immune cells, for example, white blood cells, and there's subtypes of them which are geared to fight particular infections. Certain white blood cells, like neutrophils, they are more prominent in fighting bacterial infections. Lymphocytes helps us fight viral infections and parasites, etc. So these cells constitute our immune system, and a drug, a pathological state, or an inherited disorder which uh, leads
Hmm.
to compromised white blood cells or subtype of white blood cell can technically lead to an immunocompromised state. That means
Okay.
these cells are either low in number or are not functioning as well as they should be.
Okay.
So together, this would constitute a clinical syndrome which would lead to an immunocompromised state, and these patients would be at added or higher risk to
Right.
develop infections. So one thing we know from the Wuhan experience, there have been a couple of really good publications in the Lancet. And one thing we have learned from their experience is there are a couple of risk factors which leads to added morbidity and mortality
Mm.
with COVID-19. And these are age. Age is definitely very significant. As we've noticed the elderly people are high risk for developing complication, high rates of ICU admissions, and higher mortality. Similarly, comorbidities, and that could be not just diabetes, but high cardiovascular
Mm-hmm.
comorbidities, obesity, and other chronic medical illnesses. In fact, there was a statistics mentioned in ASCO website that suggested that cardiovascular and diabetes comorbidities are probably even higher risk than having history of cancer per se in terms of comorbidities. This is based on their limited, access to data. These numbers might change down the road when we have access to more data. However, regarding your question, yes, somebody with history of cancer and diabetes, we know that would be at increased risk for developing complications if they happen to develop COVID-19. However, how to mitigate or avoid infection or complication, currently the CDC guidelines are very similar for everybody. We
Okay.
don't want anybody, be it with comorbidities or not, be infected. And the way we do that is social distancing,
Mm-hmm.
right? We try to stay away from public places, places where we can put ourselves at risk for uh, acquiring the contagion. We avoid handshakes, we avoid any physical touch, clean horizontal surfaces and fomites like door handles. We
Mm.
know from certain studies that metals, especially steel, can have a viable virus for up to 3 days. So you got to make
Wow.
sure the horizontal surfaces are cleaned, and hand washing. Make sure you wash your hands for at least 20 seconds. A lot of people have different ways to remind themselves. It's 15, 20 seconds at least with water and soap. I have this song,
Yeah.
staying alive, staying alive, and literally staying alive. So
Wow.
people gotta, like, really heed to these guidance by CDC and WHO, and
Mm-hmm.
just hunker down at home and avoid contact. So besides these, specifically for our cancer patients, I would like to give some additional piece of advice. And again, they might not be very rooted in evidence. However, I think these advice are, probably are low potential to harm. One of the things I would recommend is eat healthy,
Yes.
nutritious diet, right? Um, Food is medicine, and our immune system, health of our immune system is dependent on our diet, right? So I would encourage patients to eat, enough vegetables and plants and a well balanced diet, so they're not nutritionally compromised. That can certainly affect the immune system.
Mm-hmm.
The other thing I would like to mention is stress. Now, there are some studies not done in COVID 19 context, but we know that stress is nobody's friend.
Right.
Stress can affect immune system. Stress has been known to affect wound healing, so it clearly has impact on your immune systems and your body's regeneration
So,
capabilities. One of the things I kind of found during my research for this interview is importance of sleep and sleep hygiene.
mm,
There have been a couple of really neat studies, including randomized trial, where they had two group of people, one with who had adequate sleep, both in amount of sleep, over 8 hours, and good quality of sleep, versus those with poor quality of sleeps in less than 8 hours. And there was a statistically significant difference between how they responded to a viral cough and cold, and duration of their illness. So sleep certainly has, it's been shown to have effect on immune system. So I cannot emphasize enough the importance of sleep, and try to maintain a good sleep hygiene, try to get good night's rest, and good deep sleep. And insomnia is a very common problem in the
yeah.
United States and in other parts of the world. And there are some easy tricks people can do to fool their minds. Some of those would be avoiding caffeine or highly caffeinated sodas and coffee in the later half of the day, trying to do some light exercise during day, try to stay awake during day so that they're tired by the end of day,
Yeah.
and try to avoid watching television, bedroom, and just kind of keeping bedroom dark and quiet and for sleep. So
Definitely.
very important to maintain sleep
Yeah.
hygiene. That's a very good question, actually. SARS, MERS were both coronavirus caused illnesses. Of course, different type of coronaviruses. SARS was seen in 2002 in China and had a high case fatality rate of 8%. MERS had case fatality rate, I think, 30%, or something in that range, so very high. However, both these illnesses did not spread anywhere close to the same extent as we are seeing with COVID-19. And we are trying to understand those reasons why. Perhaps there is some new data coming up that the COVID-19 virus replicates really fast and much earlier as compared to SARS. And so patients might be shedding a lot of virus, before they even get symptomatic. And that's how patients are getting exposed before they're, it's overtly known that somebody is sick. However, COVID-19 has to be taken, we should not compare it with SARS and MERS. The current trend has shown that in matter of months, COVID-19 has engulfed almost the entire planet. There's hardly any countries left untouched by infection, right? And so it is a very contagious illness. The case fatality rates are much, much low as compared to MERS and SARS, which is a good news. But the infection rates are very high. It's very contagious. So again, really important, and there's a need for social distancing so that we can flatten that curves and not everybody gets sick at the same time and then end up needing hospital resources. Yes, but the case fatality rate is very low. Now, I'd like to point out one thing here. I don't want to comment on the actual numbers. Just like SARS, we know the case fatality rates like a 10%, and MERS 32%. For COVID-19, we don't have a clear-cut case fatality rate. And basically, case fatality rate means how many patients died and how many got infected. So it's a measure of that. And as you can understand, it depends on how many cases are being screened for COVID-19 infection. So in populations where everybody's getting screened, like South Korea, the case fatality rate is 0.5. If limited patients are getting screened because of either logistical issues, there's not enough test kits available, or some other causes, the case fatality rate could be high. For example, in Italy, 7 to 9%. In US, we don't have a reliable data yet. So I would not go by an actual number. I think people need to understand this is much less fatal as compared to the other illnesses. However, it's a lot more contagious. It can spread much faster. So people need to take it seriously and practice social distancing and hand hygiene as been advocated by CDC and WHO.